Okay, so good morning. We'll go ahead and start with a brief update on our COVID-19 response. 2 weeks ago, on August 27th, I announced that bars would be closed in 6 counties to mitigate virus activity, especially among young adults. Statewide, Iowa's positivity rate from August 28th through September 9th has averaged 9.2%, which is down from 11.6% the 2 weeks prior, which include the dates August 13th through the 27th. Johnson, Polk, Story, Lynn, and Blackhawk counties continue to have the highest number of new cases over the last 2 weeks. However, positive cases are down in each county, and the positivity rate is trending down in all but one, which was Lynn, and it saw just a very, very slight uptick over the last 2 weeks. So the data to validate that the virus activity is being driven by adults age 18 to 14 for the timeline August 28th through September 9th continues to show that that's where the majority of the positivity cases are happening. For instance, in Story County, among 18 to 40-year-olds for that time frame, they were 90% of the positive cases. In Johnston County, they were 87% of the positive cases. Blackhawk, it was 67%, Dallas, 59%, Polk, 50%, and Lynn County was 50%. So, and then again, so those are individual counties. On the statewide average, with adults age 18 to 40, it was 55%, and for 41 to 60-year-olds, it was 21%. So as we do every day and every week, we'll continue to monitor those trends and make appropriate decisions based on what we're seeing. So, you know, Iowans want to get their kids back in school, back to playing sports, and back to extracurricular activities, and I do too. I believe that our students can safely return to school and to fall sports, and I've consistently advocated for both. All across the state, school districts, administrators, school boards, and teachers are finding ways to make things work by bringing kids back to the classroom while mitigating and managing COVID-19. 326 of Iowa's 327 school districts and all accredited non-public schools have implemented return to learn plans that follow Iowa law. 3 districts have been approved to temporarily move to remote learning because of local public health conditions, and some others have been granted waivers because of the impact the August 10th derecho had on their school buildings. Des Moines Public Schools is the only one that hasn't yet implemented a return to learn plan that complies with Iowa law. And I understand that they had a legal disagreement with our interpretation of the law, but 2 courts have now looked at the issue and have agreed that Iowa law requires school districts receive state approval to move to primarily remote learning, and my proclamation that provides that approval in certain situations was an appropriate exercise of our authority. But I am committed to working with the Des Moines Public School to meet the health and education needs of our students. And part of the reason that the legislature and I are requiring that the primary means of instruction be in the classroom is because we know that the lack of in-person educational options disproportionately harms low-income and minority children and those living with disabilities. And it can lead to severe learning loss, especially for children with heightened behavioral needs. For so many of our students, our schools provide everything from a safe and supporting learning environment, a hot meal, a caring mentor, and critically important mental health services. Online learning is great for families who have the means to make it work, but it's not so good for those who live in stressed economic conditions. So my fear is that parents of means are able to hire tutors that participate in education pods, or they're finding ways to ensure that their kids are learning. And make no mistake, parents investing in and supporting their children's education is a really good thing. But so many families just don't have other options. So for example, 78% of Des Moines Public Schools students qualify for free or reduced price lunch, and that means nearly 25 students within the district. 16%, or more than 5,000 students, have individualized education programs, or IEPs, and receive special education support and services, and the state average is 13%. 23% of students are English language learners. State average is 6.5%. So we just simply cannot afford to let our students be left behind, even in these most challenging times. And I know without hesitation that members of the Des Moines School Board care about these issues as well. And that's why I'm asking them to meet with my team at the Department of Education and the Iowa Department of Public Health to work out a way for us to help get the district in compliance with state law. I also want to take a moment to address the issue of high school sports and activities, as I know there have been a lot of concerns raised about that in Des Moines as well as all around the state. Our policy regarding sports is, if a school or a district must temporarily move to remote learning due to public health conditions, then in-person extracurricular activities must be suspended during that time for the same reason, to avoid the risk of virus spread both for the home teams, players, coaches, and fans, and for the visiting teams as well. If students can't be in school safely, it makes no sense to have in-person extracurricular activities. We believe that those same mitigation strategies should apply. And I think that most parents, schools, and Iowans understand that that is a common sense approach. Like most Iowans, I have an appreciation for high school sports. I was a high school athlete many years ago myself, and I realize what sports do both for the player learning valuable life skills and the community rallying behind its team. We did find a way to play baseball and softball successfully this summer. 96% of teams finished their season, and 94% of the teams were unaffected by COVID-19. We were able to find a way to balance life amidst a pandemic, and I know that we can continue to do this. So the issue of keeping students and all Iowans safe goes beyond simply protecting them from COVID-19. A little more than 6 months ago, on March 8th, the first cases of COVID-19 were confirmed in Iowa, and our world and our lives have changed dramatically since then. We've been rightfully focused on physical health and slowing the spread of the virus to protect our families and communities and our healthcare resources. But just as important to our physical health is also our mental well-being. COVID-19 has been a challenging time for all of us, and it has certainly underscored the importance of our mental health infrastructure, our mental health workforce, and access. From healthcare workers that have been on the front lines since the beginning of COVID-19's response, to families that are dealing with the new reality of working and teaching their kids at home, to the children who have missed the opportunity to interact with their friends and their teachers each day, to the small business owner who having to furlough employees and see her own life's work become less viable each day, and to the families who are dealing with the illness and the loss of loved ones. We've seen the need for mental health and substance abuse disorder services increase pretty significantly during COVID-19. And with these kinds of disruptions to our lives and our livelihood, it is so important for Iowans to be mindful of their mental health and to know that there's a place to go if they need help. And one of those resources that help Iowans in need is Your Life Iowa. And to connect to that, you just need to go to www.yourlifeiowa.org, or you can call 855-581-8111. I am pleased to be joined today by Liz Cox, who is the CEO of the Polk County Mental Health Region, which provides a wide range of mental health and disability services for the people in the area. So, Liz?
Thank you, Governor. Thank you, Governor Reynolds, for inviting me here today. And I also was a former high school athlete. I think you're a basketball player. After COVID, I'll take you on.
Okay.
I'm pleased to be here today to speak about mental health and COVID and the community-based supports that are in place to help. As mentioned, last spring, a dense fog of the unknown rolled across Iowa, overwhelming our work routines, disconnecting us from trusted friends, coworkers, and family. We've all experienced changes at home, social isolation, loss of a routine, lack of sleep, and for some, a loss of a job or a loss of a loved one. And Iowa's mental health needs are broad. Data from the Household Pulse Survey published by the CDC shows that anxiety and depression are at an all-time high, with nearly 40% of Iowans reporting feelings of despair and worry, symptoms of anxiety or depression that have been shown to be associated with diagnosis of generalized anxiety disorder or major depressive disorder. For comparison, this time last year, the national rate was 11%. Women report higher rates of anxiety and depression than men in that same survey. And how we cope with stress is important. Rather than turning to drugs or alcohol, negative self-talk, or overwhelming ourselves with work, we have better mental health outcomes when we take time to decompress, when we talk to a counselor, a friend, a faith leader, we exercise, or we ask for help when we need it. Our ability to ask for help, our ability to accept help, and express our feelings are critical to resilience, and help is available. Mental health warm lines like Your Life Iowa offer 24-hour support. Mobile crisis teams are in place in many counties providing on-site support for those suffering with a mental health crisis. And here in Central Iowa, we have 2 walk-in mental health urgent care centers. Many school districts have added licensed therapists to their staff and designated telehealth spaces in their schools. And while these resources are available, we should not overlook the power of simple human connection, the small gestures between strangers or warm phone calls between friends. A smile or a comforting word may tip the balance towards life and counter thoughts of a lethal act. Science tells us the qualities of resilience are dependent upon our relationships. And when we do this well, together, we lift the fog. These relationships can be our most powerful tool in supporting our mental health. And by using the tools we have for mental health and our relationships, we reduce the risk of suicide or deadly overdoses. So if you or someone you know is showing signs of being at risk for suicide, talking about wanting to die, talking about being a burden to others, or using alcohol or drugs more often, please say something. Listen non-judgmentally, give reassurance and information, and encourage appropriate professional help. And just a reminder, suicide prevention hotline lifeline number, 800-273-8255. And the Polk County Mobile Crisis Response Team is available by just calling 911. And as mentioned, Your Life Iowa helpline available online and at the number 855-581-8111.
Thanks, Liz, and thanks for all the work that you do in serving those in need. Today is World Suicide Prevention Day, and according to the CDC data, the suicide rate, as Liz had mentioned, increased significantly over the last decade, and people in rural areas were more likely to die of suicide than those who live in cities. And that's why it's so important that we have the support and the ways to detect warning signs for those suffering from mental illness. I want to thank Liz and the Polk County Mental Health Regions and all of our mental health regions for the incredibly important work that they do to help Iowans in need. So another critical need for Iowans during COVID-19 and the derecho is food security. Several months ago, I asked our Lieutenant Governor to chair the Feeding Iowans Task Force when it became clear that COVID-19 was severely impacting the ability of some Iowans to put food on the table. I'd like to have Lieutenant Governor Gregg provide an update of the task force and its work. Lieutenant Governor?
Well, thank you, Governor, for the opportunity to lead the Feeding Iowans Task Force and the opportunity to give a brief update here today. As you may recall, many of us have been working to address the challenges related to food insecurity that have arisen as a result of the global pandemic. We've been looking at creative ways to meet the needs of Iowans, and our work has been greatly impacted by the governor's decision to allocate significant CARES Act dollars to our efforts. Governor recently has increased that allocation to $3.9 million, and I wanted to give you an update on the impact that those funds are having. First, on the Pass the Pork and Beef Up Iowa initiative, which are the programs where ground pork and ground beef are donated to the food banks. We anticipate that when all is said and done, that 100,000 pounds of ground pork will be delivered to Iowa's food banks. That's 400,000 servings. Well over 50,000 pounds of that has already been delivered, with more coming here throughout the fall. On the beef side, 14,500 pounds of ground beef have already been distributed to the Iowa food banks. We believe when all is said and done that we will have processed 110 cattle, resulting in 55,000 pounds of ground beef, which is over 200,000 servings. Two other quick important things to note on that. The processing of that livestock is being done at the meat lab at Iowa State University. And I think that's important because it allows the students to gain a learning experience while also impacting their community in a positive way. The other thing to note about that is the cattle and the hogs that are being purchased and processed are livestock that were raised and shown by 4-H and FFA kids that showed their livestock at the various scaled-back county fairs and the state fair this year. So that provided a market for their animals and also gave us a way to support youth in agriculture while also helping food insecure Iowans. Governor Reynolds also dedicated additional funding to a program we called Pack the Pantry. One of the barriers that we heard about from Iowa food pantries was a lack of refrigeration, which impacts their ability to accept products like the ground beef and ground pork that I just talked about. This program has now granted $440,000, which will fund 113 food pantry refrigeration grants in 51 counties. And Iowa's egg industry plans to fill them up with eggs as well. Typically, the Iowa Egg Council and Iowa egg farmers donate 35,000 dozen eggs per month. And during the pandemic, they've increased that to 45,000 dozen eggs per month. That's over 500,000 eggs per month. Pretty remarkable generosity on their part. In addition to these efforts, we've also sought to support Iowa turkey growers with over $100,000 of turkey purchased through West Liberty Foods and likely more purchases coming here in the near future, again, all distributed through Iowa's food banks. We've also distributed $1 million in financial grants to Iowa's food banks to assist in food acquisition, and another $1 million to the Double Up Food Bucks program, which is run by the Healthy Estate Initiative and allowed them to expand to over 100 additional locations throughout Iowa, but particularly in rural communities at grocery stores and farmers markets. There is one area where we still need the public's help and would appreciate your help in getting the word out on this. It's around our bulk purchase and repackaging of shelf-stable items like oatmeal, rice, and pasta. So we buy those products by the truckload, and through a partnership with AmeriCorps, we've been repackaging those items into smaller bags that are useful for families. So far, they've already packaged over 345,000 pounds of food and provided over 288,000 meals to families in need. However, with some of the AmeriCorps resources being diverted in response to the derecho, and with typical volunteer sources maybe less available than they normally are, folks like senior citizens and business groups and college students who might typically volunteer, we do need some more help packing these items, particularly at the Northeast Iowa Food Bank in Waterloo. So if you're able and interested in helping, go to volunteeroiowa.org and click on the banner that says Help Reduce Hunger in Iowa. Again, it's at volunteeroiowa.org. So with that, thank you to the generous Iowans who have donated to support these causes. Thank you to the members of the Feeding Iowans Task Force who have worked hard to think creatively to meet the needs that are out there. And of course, thank you to Governor Reynolds for providing the financial resources that we've needed to execute on our plan to feed Iowans in need. Thank you.
Thank you, Adam. The Feeding Iowa's Task Force has really been a success story in bringing together private and public partners to address the urgent need in fighting hunger. And I certainly appreciate your leadership and the commitment of all of the task force members. And with that, we will open it up for questions.
Governor, the state's website indicates that over the past 24 hours, the deaths of about 20 Iowans, recent deaths, have been confirmed and reported as COVID deaths.
Yeah.
Conservatives have told me, and Senator Ernst raised concerns that the number of deaths is inflated. Is the state website accurate?
Yeah, I think that the state website is accurate. The deaths that they reported this morning actually are from the timeline from August 18th through the September 9th. Dr. Badati, do you want to walk through the process and how they're confirmed? I think that would be helpful for Iowans to know what that looks like.
Yeah, so we work very closely with our vital records partners to receive information when there's an indication on a death certificate that coronavirus has caused a death. And we use the information that we receive in public health about positive case results to put that together and share that on our webpage. So we do that as we get that information. Sometimes it does take a little bit of validation. Sometimes it takes medical examiners some time to complete those certificates. But we check that information, and that's what we share on our webpage as soon as we've confirmed that. And so what that means is that we might report a group of deaths in a given day, but the dates of death, so the date that someone passed away, may have happened a little bit in the past. And so, again, it's an example of a place where I would say we work very hard to make sure that we get comprehensive and accurate information put on our webpage as quickly as possible. And I think in addition to understanding the individuals, who have passed away in association with COVID, we also try and share information about age and about underlying condition to help people continue to understand that, we know that there are people who are older or who have underlying conditions who unfortunately experience more severe outcomes from this virus.
Governor, the change for the absenteeism and what qualifies. Previously, absenteeism on August 14th defined by the Department of Education as all students absent due to COVID reasons, including quarantine. But more recently, in a meeting on this issue, schools were instructed to not count quarantining as absenteeism. Obviously, this is going to make it potentially harder for some schools to go online if they can't count those quarantine students. So why the change, and why are quarantine students any less absent than someone who's home for infection?
Yeah. So it doesn't, so it wouldn't necessarily impact their qualifying. The 10% absenteeism is another guideline and a criteria that we look at, but it's not the only one. And I might have Ann address this too, but it's the absentee tracker, and this was actually clarification, and that was always to measure those who are ill and not healthy. And when you're quarantined, it's because you've potentially been exposed to somebody that tested positive. It doesn't necessarily mean that you're ill or not healthy. And now with the online learning component, students are able to still continue learning online. Ann, do you have something to add to that? Okay.
And I think we're trying to make sure we get something in writing on that, because I know that question has been presented. The challenge lies within the process we have to collect the information, because previously everything that's reported to the Department for Absenteeism is absenteeism for any reason. Current circumstances allow students to learn online in different situations, so they might be self-isolating, but if they're still going to school, they're not technically absent because they're still learning. So what we're trying to do is make sure we're gathering the information of students who might be sick that's reported to public health, and then we meet to have a conversation what that looks like. So we would have to create a whole new reporting system for schools in order to create a different specific scenario for this. So rather than adding that extra layer, we're just trying to make sure they report everything consistently through our system, but then we follow with public health. I think what's important to note is that all the waivers we've approved so far are prior to school even starting, so absenteeism wasn't a factor. So it doesn't prohibit your ability to apply. You're also welcome to provide absenteeism information to us in any format you want as part of your waiver request that we'll consider. The real challenge is just in the system. We were trying to prevent a whole nother reporting system to be developed and put in place just for this short period of time.
That's the other thing I was going to bring up, is that it doesn't prohibit, and actually the waivers that we've issued, that wasn't part of the criteria. And And I think one of the things too, Caroline, that we're going to see, and we've said all along, is it just continues to change. And so we have to be flexible in how we work through COVID-19. And as we learn more, as CDC makes changes that they're bound to make, we have to adjust and adapt to what those changes look like. But I think the main takeaway, and I think that was maybe your question, is that that doesn't prevent them from really applying for a waiver and having the Department of Education and the Department of Public Health review those.
Governor, can you talk about the football decision at Iowa State? I'm going to squeeze in a two-parter here if I can, but
Sure.
Last week when you were out here, you had said you supported the decision for them to have limited fans in the stands. From what we learned later in the day, apparently the president of the university had already communicated with Jamie Pollard the night before that was not going to be allowed. Can you share why that was not communicated with you beforehand, before it went public? And then also now in retrospect, have they made a decision, or have they made a mistake rather, by not allowing fans?
Well, that's their decision to make, and they did it based on the information that they have. I'm not involved in those discussions or a part of it. But again, Dave, I think I've been consistent from the very beginning. I think that we can figure out a way to do in-school learning, in-person learning, and provide extracurricular activities for our students, and we can do both in a safe and responsible manner. So I was trying to look at the capacity of the field and the amount of individuals, the fans that they were letting in. And I learned that was a change after the press conference. I don't know if it necessarily would have changed my response, except for that I defer to them to make those decisions. I wouldn't have changed that, but I would continue to say, as we learn to live with COVID-19 until we have a vaccine, we have to learn to live with it, and we have to start to bring some normalcy into our lives. And so when we can do that safely and responsibly, but we have to provide the information. You have to understand if you're an older adult or if you have underlying conditions, then maybe you shouldn't go to the game. But if you're healthy and you want to go, and we have the social distancing in place, and you want to put on a mask in addition to that, then I think there's ways that we can move forward with that.
Governor, and despite the fact that, I'm sorry.
If quarantining doesn't affect absenteeism, how does that play into outbreak control in schools?
Well, I'm not sure if I understand the question, but it's a part of it. It's just not the single factor.
So I think what's sort of unique about this year is that, prior to this year, if you're absent, and you didn't have the ability to learn. Right. Now you might be absent for a variety of reasons. You might be absent because you're choosing to learn, well, that's not absent. You're choosing to learn online. Have you been exposed, but you still feel well enough to learn, and so you're in attendance because you're taking your classes, but you're not in the building? Or are you so sick you're not able to learn, therefore you're counted sort of absent that day? And that's a really challenge to report specifically within one system. So attendance has always been reported as you're not there, and that's a challenge. So any kid right now who's not in school for any reason would be reported as part of that number. What we are doing when we meet with public health is looking at the cases that are identified, the positive numbers, how is that impacting their population, and then using this as one piece of that conversation.
And so if absenteeism is just a guideline, why put that number out there?
Dr. Padati, I think you probably would say, I'll kind of give you a chance to maybe weigh in on this too, that we're trying to align it similar to what we do with flu. Do you want to just kind of walk through that again with them to talk about how we're trying to apply this in the context of COVID-19? That's something we've never experienced before.
Yeah, I think there's maybe two things I would share. One is that in addition to the Department of Education absenteeism data that's collected, the Department of Public Health collects absenteeism data, and we do that in a different way. And we've done that for a long time, primarily focused on flu, but it also helps us understand if there's a norovirus issue or another type of illness that's happening in a school setting. So that's part of why we continue to ask schools to report to us when they're seeing absenteeism. And the public health question around absenteeism, right, has got more to do with illness. And I want to know about illness, whether it's COVID, whether it's flu, whether it's norovirus. I want to understand if there's something happening in a school setting that we need to know about And again, this is a relationship and an approach that we've taken primarily around flu. It's something you'll find in our weekly flu reports that we've published every week, like many other states. And again, it's another way to help us understand sort of the health and illness patterns in a particular setting during respiratory, viral, or winter season. And then I think the other thing I might share in addition to that is the approach to do a case investigation and recommend quarantine for people who have been exposed doesn't change. We're still recommending quarantine for people who have been exposed to a case of COVID, and that is still going to be important to do because, again, the goal there is you're well, but you've had an exposure, and so if you stay home, if you were to become sick, there's nobody for you to pass that on to, which is the way that we can stop that chain of transmission.
Governor, sorry.
Can I come back to you?
Yeah.
I think
Governor, just quickly, with the courts having ruled against Des Moines Public Schools, is it your hope or your expectation that DMPS will fall in line with the 50%
my hope
in-class
is
learning?
that we can sit down with the Department of Education, the Department of Public Health, and start to walk through what we can do to bring them in compliance with the return to learn plans. And so I'm hoping that, that's what we'll be able to accomplish. And I know the Department of Education is hoping for the same thing. So much like we've done with school districts all across the state, I know Director Lebo and her team has spent countless hours working with superintendents and school boards across the state to figure out how we could help them become compliant with their return to learn plan. And so I hope that that's what we're able to do, and we get those kids, back in school, especially those ones that I talked about that need those services. They need that safe environment to learn in. They're counting on a hot meal. They're counting on a mentor. They need those behavioral health services. They don't have the extra funds at home to take the extra steps to make sure that they have every opportunity to learn and be successful. And so, COVID is a part of it, but we have to look holistically at the child and what we need to do to help meet their needs. And I believe that's everybody's goal. So, we're in unprecedented times, and this isn't easy, but there's a lot of great resources and a lot of great examples of what schools have done to be able to meet the needs of those students that we're talking about and do it in a safe and responsible manner. So I'm very hopeful, and I hope that we can get together and get that done sooner rather than later, because I think also that uncertainty is impacting the kids across the board, those that want to do extracurricular activities and those that really need to be back in school, and they need those services that our educators and that environment provides for them.
Governor, Co-Diagnostics is developing a new test that will identify both COVID-19 and influenza.
Yep.
Is Iowa looking at purchasing that specific test, or is there a different multiplex test we're looking to buy? And when should we expect to see that rolled out? Because we're starting to get into flu season here pretty soon.
So we're looking at all of those. Remember a couple of weeks ago, I talked about our long-term testing strategy. We talked about the number of co-diagnostic tests that we bought, and we timed that through 6 months because we realized that there would be different strategies that would be applied moving forward, whether it's a saliva test or whether it's a multi-test or what that may look like. So we'll continue to look at what those opportunities are and where we can find the best means to provide that testing for Iowans. I don't know if Caitlin knows I'm looking at her, but am I missing anything, Caitlin? I know Dr. Pantella at the State Hygienic Lab is a critical component of this also, because he has to be able to run them. Is there anything I'm missing?
No, I would just add, again, we're awfully fortunate to have our State Hygienic Laboratory and Dr. Pantella, who's worked to help us consider a variety of options. We have conversations really every day to look at what are the emerging test types, what makes sense for us here in Iowa, what will we need to meet the needs of evaluating patients for flu and for COVID. So I would say, again, it's an incredibly important relationship we have with our State Hygienic Laboratory, and we continue to look for ways to use new testing resources, potentially even new specimen types in the future, ways to make sure that we're providing the public health support that's needed here in Iowa.
Will a new test need to be validated, and will it take as long?
Well, they have to go through the same process, right, Caitlin?
Yeah, so, I don't, I'm not the public health lab director, but all tests require validation. And so, I'm sure we could follow up and get some additional information, but any test would require validation, and the amount of time it requires varies.
Yeah.
So would these be available through the Test Iowa sites?
Well, a lot of that is
Through
still
the
to be
app?
determined. So, it depends on where we would get it. It would depends on what that specimen looks like or how that's taken. I guess, Caitlin, I'm trying to pick up on the language that you're using as a doctor. And then, Kay, how we would make those available to the public. So, right now, it's not only through our Test Iowa drive-up sites, but we're working with clinics across the state, especially in rural Iowa, to be able to provide them access to that same type of testing. It's maybe something we can work in conjunction with our schools or with our long-term care facilities. I mean, it depends on what that looks like, how much access we have to it. At the beginning, testing and the reagents that was a part of it were really hard to come by. So, all of that will play in this too, but that's why we're having those conversations and have been really having those conversations for quite some time. It didn't just start last week. They've been very proactive in trying to be ready and anticipate what a flu season looks like. How do we do a multiple test if that becomes necessary? What happens if we have a vaccine? There's all of those things are discussed with the team on a daily basis. Okay.
Yeah, Dr. Padati mentioned the quarantine recommendations, 15 minutes within 6 feet of someone else, if I remember right. There are schools that are having their students get up and move around every, 10, 12, 14 minutes. And I'd be curious to hear Dr. Padati on this too, but I'm curious if you think that's a sound public health strategy, or is that just a way that schools are maybe trying to game the system and limit their number of students they have to put in quarantine?
I don't know if I'd say game the system, but I'm going to let Dr. Padati. I think everybody is trying hard to figure out a strategy, but Dr. Padati, you as the epidemiologist in public health, would you answer that?
Yeah, no, I know that this is hard, and I know that people are looking for ways to minimize risk, which is what we all want to do. But really the idea here, again, we've got a virus that moves from person to person. And so, minimizing person-to-person interactions, is how you can minimize the transfer of this virus. And so, the advice that we've provided is that, rather than have people interact more, right, and create more person-to-person interactions, really, you want to have fewer person-to-person interactions, and you want to incorporate all of the layered strategies that we've talked about, right? So beginning with staying home when you're sick, staying home when you're exposed to somebody who's a case, maintaining distance when we can, using face coverings, practicing hand hygiene and cough etiquette. Those are all really important things to do together. But I think for that specific example, again, it's not so much about meeting a time cutoff as it is about limiting those interactions. And so we're trying to support schools in looking at their space, looking at their populations, and coming up with ways to minimize those interactions rather than being too focused on that 15-minute cutoff.
By them doing that, by having students move around, is that an additional safety, layer?
I think she's saying it's not.
Yeah, so I wouldn't suggest that as an approach, right? But what I would do is, and what we have done, right, is have conversations with schools about how can we work with the spaces we have, work with the groups we have, use all of the right public health measures to limit the opportunities for person-to-person interaction.
So you do layered mitigation, so if you can't quite be 6 feet, you got the face shield, the mask, there's other things that you cohort. There's other steps that we can take, I think, to get to the same result that we're all trying to do, and that's to prevent people from, contacting COVID.
On that point, I guess, so I've seen photos of you at events,
Yeah.
Public events, party events, I think political Republican Party events without a mask and with people in the room at relatively close distance. Do you Do you practice masking yourself to the degree that you would like us all to practice it? I guess I just want to get your response to some of that criticism that people have seen you without a mask.
Well, no matter what I do, and people aren't with me 100% of the time, and I don't think a snapshot really tells the entire picture. As you've heard Dr. Padati say, you have to be within 6 feet for over 15 minutes talking in order to potentially, I mean, I think there are probably other means, be exposed. So a lot of times what I do, and I have a mask on often, especially if I can't social distance. So, but a lot of times individuals, when we're at an event, no matter where I was at a Main Street business yesterday, talking about how COVID had impacted them, and that actually business was actually very good because the community had supported them and really helped them sustain. They received a grant from IEDA, and they were very grateful from that, and they were optimistic about their future. And I tell you what, that was some good news in this really time of some troubled times. And I'm hearing that consistently as I travel. But there, we had our mask on, and I didn't at first because I was socially distanced, and then we got a little bit closer, and I put it back on, and we went outside. And a lot of times we will have them on until we take a picture. Sometimes we do it with and without. We'll take them off for about not even a minute, snap a shot, and then we'll put them back on. So I try to lead by example, but remember, if you can social distance, but if you can't, you should have one ready and you should put it on, and that's what we're trying to do as we travel across the state.
Thank you for answering the question.
Thank you, I appreciate it. Appreciate the question and the opportunity.
About 20 years ago, the state established a process for a child fatality review committee to examine child deaths in Iowa to determine whether or not the Iowa Department of Human Services had responded appropriately to complaints of abuse. That committee has never met in 20 years. And just a few months ago, we had a federal judge rule that the Department of Human Services, the agency that's charged with protecting children, the judge had ruled that the department was actually torturing children in its care at the Eldora home. Can you talk a little bit about what Iowa's doing to protect Iowa's children and specifically to address those two issues?
Yeah. Well, I'm not sure about the committee that was put together 20 years ago, but I think probably your best individual to talk to would be Director Garcia from the Department of Human Services. One of the first things that I did is to bring in new leadership at the Department of Human Services, and Director Kelly and her team have done a phenomenal job of really getting in there and not only doing internal audits, but many times they've asked for external audits to come in and really identify the practices and areas where they need to improve in how they are addressing kids, especially some really severe high-need kids or kids that have significant records that have had some significant issues in their past. And so, we meet on a weekly basis, and I know since she has been here, which I think has maybe been a little over a year, or maybe not quite, we're really close to that. We're never where we want to be, and we're always looking for ways that we can do things better. But I really, really am proud of the team that she's put together and the significant steps that she has taken to address a lot of significant issues that the state was facing. And so, Clark, we're a long ways from being done, but I believe under her leadership, we are moving in the right direction, and nobody wants to see children placed in situations where they're not being taken care of appropriately. So, thank you.
Governor,
I'll go back, and then we'll come back.
Governor, I just want to bring some clarity to this 10% absenteeism issue for the schools going virtual.
Okay.
When you first brought out the guidance for these requirements for schools to go virtual, that 10% absenteeism was presented as a requirement. And now you're
a
saying
guideline.
that it's not really a requirement. So can you just provide clarity to, school administrators I've talked to have been confused about this. So will you not reject a waiver based on someone not meeting that 10%?
So I think actually we've done that already. And so those are guidelines. And, I think the thing that we need to we're trying to provide guidelines Our goal, I think, is to get everybody back in school, to make sure that we're doing safely and responsibly, for all of the reasons that I've already talked about. But there are some times when school districts apply for a waiver to go online if they think there's significant virus activity within their community, or they've seen a significant uptick, and we put some guidelines in their absenteeism. And so when they apply for that waiver, the Department of Education, in coordination and collaboration with the Department of Public Health, they go through that and then make a determination on whether they feel that they meet the criteria to go 100% online, or if it's just a classroom like the superintendent did in Indianola, where they had positive cases in one class. They took, working with their local Department of Public Health, which school districts should be doing that, they took that classroom and isolated, quarantined them. They went online for 14 days until they could see if anybody else was exposed. They could continue learning, but the rest of the building was able to continue to operate. The kids were able to continue to go to school, and things moved forward. So, as I said, I think I started to say, I don't know, kind of got sidetracked, but things are going to continue to change. This has been a fluid situation. We learn new information all the time. The CDC is constantly updating and helping and trying to figure out, what the latest criteria is. And so we're trying to work with school districts based on data that's in Iowa, based on CDC recommendations, based on what the Department of Public Health and Department of Education is seeing.
Just to follow up quickly on David's point about the masks.
Yep.
I know you've repeatedly said that you don't support a mask mandate.
Yep.
And one of those reasons is that usually in the same breath, someone will say, well, we're not enforcing it. Even if that's true and people defied a mandate, why wouldn't you just do it to send a clear, resounding message that, hey, like what you've said, Iowans, you'll help your neighbor by wearing a mask. Doesn't a mandate send a clear message and clear up any discrepancies or criticisms about, do as I say, not as I do type of thing?
No, I don't think so. I think the goal is to do what we can to reduce the spread of the virus. I think the goal is that if you can't social distance, wear a mask. Criteria says that. If you're sick, stay home. Wash your hands frequently. The list has been consistent from the very beginning. And actually, the mask mandate, yes and no, hasn't been consistent from the very beginning. But the information about staying home when you're sick, cover your cough, wash your hands often, disinfect areas that you use frequently, and if you can't social distance, wear a mask. And so I believe that that is the end goal, and that we can get there without a mask mandate. And I believe that, and that's what I'm going to consistently do. And I trust Iowans to do the right thing, and I think they are doing the right thing.
Iowa, North Dakota, and South Dakota are 3 states that lead us in virus spread, and those are 3 states where governors don't have mask mandates. Do you
but
think
it fluctuates. It's a snapshot in time. David, I can go right back to, I know where those positive cases are coming from. Let's see, it's 18 to 24-year-olds. 90% of the cases, positive cases in Story County, was 18 to 40-year-olds. 87 in Johnson. Through the contact tracing, we can tie to what they're doing. It's congregate settings. It's getting together. When they're socializing and doing what they're doing, they're not necessarily wearing a mask. So, we know, and we're not seeing that impact our hospitalization either. Those kids aren't going to the hospital. What I'm concerned about, though, is when we start to see the increase in virus activity in the community, then if it starts to impact our healthcare workforce, then it starts to become a problem, or our educators, or our first responders, or our CNAs, or our, that are working in our long-term care facilities. Once we start to see that starting to happen, we have to think about what we're doing. And so, again, encourage people to wear them if you can't social distance. Businesses have the opportunity to mandate that, and I think we're seeing, I think people are doing the right thing. I think I answered your question.
The rules for football and volleyball in the fall be the same as they were for baseball and softball in the summer? Those students who participated in summer sports hadn't been in a classroom since March.
Yep.
And as you mentioned, 95% finished.
Yep.
The 5% that didn't had a positive case and they quarantined. Why wouldn't you do that for all schools?
Well, because, Kay, I don't think you can separate. I think if these school districts are applying to me for a waiver and they are saying the virus activity is so significant in my district that we don't feel like our kids can be in school, or we don't feel like they can be in school because they can't social distance. So that same criteria, that same mitigation can't be separated from extracurricular activities. And how about districts? We're getting calls that, they're supposed to play, and they said, my parents and students are concerned because Ames or whoever has said that the virus activity is so significant, we don't believe that those kids can go to school to learn, but yet we're okay with them playing football on a field where they are less than 6 feet apart, and there's a lot of screaming and yelling and activity going on there. And so I don't think that you can separate the two.
Governor, along the lines of the
I need to take the call on the phone. Is there a phone? I think there's somebody on the phone.
Yes, thank you. It seems that I almost need to be in the Des Moines Bureau for something. Anyways, I have a couple questions here. I'll try to get through them quickly. First of all, health experts have said that it's only safe to go to school when there's a 5% infection rate. Your guidelines say that it has to be a county that has to have 15% positivity before you can issue a waiver. That's triple what is recommended. The question on this is, why set that so high? Secondly, do you support Speaker Grassley and Leader Whitford's signing the letter urging the Big Ten to return football to the fall?
Okay, back on the positivity rate. So I think the reason that we have it a little bit higher is because of some of our rural communities and the number of tests. When we put that into context, it doesn't take very much if they're not testing. If the denominator isn't, Caitlin, help me out here, impacts the positivity rate because there's so few testing. And so we tried to balance that with what we're basing it on statewide. But I can tell you that they are moving in the right direction. And right now, we have 51 counties that are anywhere from 7% to 2% positivity rate over a 14-day period. So we are seeing those move in the right direction. I guess, and Caitlin will probably say that, but the other component of that is why you need to work with your local public health and with the Department of Public Health to understand what is happening in the area that may be influencing that too. Is that correct, Caitlin?
Yeah, again, I think that part of what we want to acknowledge, right, is that a percentage positivity is tied very much to the population and to the amount of testing that's available and being performed. And so we want to keep in mind that, there may be variations depending on the size of the population. There may be variations depending on the group that's affected, that's driving, for example, virus activity in a particular area. And then in addition to understanding things like percent positivity, we always continue to follow up on each case and perform a case investigation and recommend quarantine around that individual, which are important public health measures that we're going to do no matter what the setting is. And then I think finally I would just say again, we continue to look at best available data, ways to adjust and improve. And as we learn more and as there's more information that's available, we're going to continue to do that.
I should have just gone to you first. And the last question, we have already been working with several other governors to send a letter that would effectively say the same thing. So hopefully that'll be going out today or tomorrow. So thank you, everyone.